Thank you for joining Wellness West for their 4th annual event to talk about the important topic of healthcare transformation on the west side of Chicago and beyond. We have a lot to cover today, so I'm going to jump right into it, but I do have some quick housekeeping notes. The first thing I want to say is that you have handouts at your seat that has information on assessing our Spanish language translation. When dialing in to hear the translation, please keep your phones on mute. The second thing is we have sign language as well, interpretation, located here to my left. The sheet also shows you how to ask a question of the speakers, and I encourage you to submit questions throughout tonight's discussion, not just at the end of the discussion. For those of you posting to social media about tonight's event, we encourage you to use the hashtag Wellness West Chicago. That's hashtag Wellness West Chicago for your social media posts. Let me also acknowledge at the onset of tonight that we are all kind of operating in very challenging times and also unprecedented times, but as one of my board members said, that this is our movement and our time to have a great impact. Members of our community and other of organizations specifically from elements of funding cuts to being traumatized in our own homes. And I want to make sure that that is acknowledged here today as we reflect on the importance of working together to deliver care for those individuals that are most in need. So tonight I just want to remind you that Wellness West and its partner organizations stand united in our efforts to continue to serve our community, and we will continue in our efforts together. Now, here to make some brief opening remarks, allow me to introduce the Chair of Wellness West Board of Directors, Mr. Jose Sanchez. He is the President and CEO of Humboldt Park Hospital. Let's please give a round of applause for Mr. Sanchez.
Thank you, Misty. Good evening, everyone. Misty, I will follow your direction. She tells me that I never follow the write-up that she gave me, so I will follow that today. But it's indeed an honor and a pleasure to be here today with so many of you. I wanted to really welcome again our elected officials who actually make a difference for all of us to be here as a group, and without their support and the funding that we get from the state, some of the action, our patients recognize HFS for their support, believing in the work that we are doing, and again, thank you. As Misty mentioned, these are very difficult times in our lives today. I have to say that some of the action by the federal government are very frightening here in our city. And I guess what is more terrifying is the fact that our patients, especially in communities like the one we served, are afraid to get the care that they need. The trauma that our patients are experiencing is very distressful, and it's real. I had the unfortunate situation, actually, last Friday, where two agents from ICE chased an individual as they raided a Walgreens in our community, and he ran out. They followed him. He tried to jump a fence, broke his legs, and ended up in our emergency department. The behavior of the federal agent is incomprehensible. Did not want to comply with hospital policy or identifying themselves, providing information why they were there, even though they brought the patient into the emergency room, but they refused to cooperate. And they were not pleasant as they related to our care providers who take care of our patients. I don't know in which times and in which country do we live today. I never had that experience in my entire life. And I wanted to ensure that we protect those individuals that are in our community. While the patient was being treated in the emergency department, there was an immigrant that actually walked into the hallways, and I was in the hallways, and she needed to see a doctor, and she was covering one eye, and I asked her, "What do you need?" And she says, and I had to say to her, "We're under very difficult."
Clearly, she was a Latino person. She spoke to me in Spanish, and I had to say to her, "Don't go to the emergency department, go to my office." I had to pull her into my office and call a doctor to see her in my office. This is not the healthcare that we know, folks. We should not be afraid of taking care of people. Our people should not be scared to get the care that they need. It is sad, and we lived under very difficult circumstances. I need to say this because people don't understand. If you don't have the experience of the thing that is going on
In our communities, people could not even imagine what's going on. So let's continue to stay together, work together, protect our patients, give the care that they need. We are here to be the voice of the voiceless, to represent those that do not have representation. And I need you to rally behind me to protect our communities. I wanted to move on by say again thank you to all of you. As you know, WellNet West now represent nearly 50 partners organizations that continues to improve the health of our communities. Many people are responsible for Wellness West success, but in particular, I would like to ask Wellness West board members to stand and be recognized for the work that you have been doing. It is my honor to work with this group of individuals on an ongoing basis. And I think Donald Duke, who is my co-chair, we are one in this work, said a little while ago that we have a call every Monday to check in to see what we need to do. We got executive committee meetings, we got board meetings, and we have these gatherings every year. So I want to thank my board members for your support your vision, and your commitment to this work. I would like to also recognize the hard work of so many individuals. You know, I always think about that. Some of us have the luxury to be successful, and people give us all the credit for what we do. But I got to tell you, the real heroes, the people who make the difference every single day, are those members of our staff that actually make things happen. So I want the members of our Wellness West to stand up. We want to recognize you for your hard work and your dedication. And you know, I have always the privilege to work with great people. And of course, a special thanks to someone who is very special in the work that we do, and that is our leader of Wellness West, Misty Drake. I want to thank you all. I mean, I think I tried to stay to the script, Misty, but I couldn't help but thank you. There are so many healthcare leaders today. You're going to hear a panel in a little while, which will be introduced. Some of them I know, but these are the people, not only that they healthcare leaders, but they care about what they do. Because the kind of work that we do is a mission. It's not a job. If you don't think about having a mission in your life to take care of others, then it's not the work that we are doing. So with that, I want to turn it over to Misty once again. And this is our true leader who make everything happen. Can you applaud Misty?
Thank you, Jose.
All right, I am gonna pivot a little bit in the interest of time. First of all, thank you, Jose, for your leadership. And this is the sense of compassion, urgency, and commitment. I have the privilege of experiencing that every single day. And so I want to just thank the board. But what I do want to get to, we did want to share a little bit about some of the impact that we've had this year. We're a little bit behind schedule, so what I'm going to say is that we have an impact report that I believe you can have access to that on our website, and there may be a QR code that is on the table for you to download that. Because I really want to make sure that we have ample opportunity to really have a rich dialogue about the importance of healthcare collaboration, the impact that it has on patient outcomes, as well as on reducing total cost of care. So now what I'm going to do is kind of move to the rest of our program. And we're going to be doing something a little bit different today than what we've done in previous years. We'll have two topics that our expert speakers will address in two back-to-back sessions, very brief sessions. The first session will address the topic of a multidisciplinary approach to healthcare through the Illinois Healthcare Transformation Collaboratives. And the second session will take on the sustainability of those collaboratives and the collaborative approach. Our moderator will introduce each session participant. So to start things off, allow me to bring to the stage tonight's moderator, a 15-time Emmy Award winner, WGN TV anchor and medical reporter, Dana Baer. She's going to start us off, and we thank her for being here today.
Hello all. If we could have our first panelists come up so I can introduce you. I want to say thank you for welcoming me here tonight for a really critical discussion. I know that all of you in this room face challenges every single day. I've been a health reporter at WGN for 35 years, And it has been my great pleasure to tell the stories of the work that you do in helping patients and making a difference for them when otherwise they might not get that kind of extraordinary care. So thank you. You all owe yourselves a round of applause. Tonight, we come together with a single mission, and that is to improve care, but more importantly, to do it together. And I have our distinguished panelists up here that I would like to introduce. Dr. Omar Latif, who is the president and CEO of Rush University System for Health and Rush University Medical Center. Brenda Palms, to my right here, president and CEO of the North Lawndale Employment Network. And Heidi Ortalaza Alvear, who is the CEO, Infant Welfare Society Family Health. So most of the people in this room probably know who you are, and I know that you are leaders in this space of very important West Side institutions. Very differently, you do a different job, but you are critical components in this idea of the wellness ecosystem on the West Side. So we got together and we discussed what we were going to discuss tonight. And to a person, everyone said it was the cooperation, it was the collaboration that is so critical to give care to those in need. So I want to ask each of you, and Brenda, I'll begin with you, what you see as your role in this collaborative effort in the safety net ecosystem.
Thank you for the, first of all, can you all hear me?
No, not yet.
Yes? Oh, there I am. I hear me. All right. Great question. I think that what this partnership does for us, and it is to connect people who are from the West Side, those who often are more economically vulnerable and income constrained, with access to quality health care in a way that we never ever thought about from a workforce development perspective. And I think that what's interesting is that workforce has truly evolved over time. There was a time when we thought that all we needed to do was help a person get a resume and give them a few tips on how to get a job. You know, interview well, and then get the job and you're off. And then we understood, just like we commissioned a study in North Lawndale and learned that 57% of the adults in our community had some involvement in the criminal justice system, it fundamentally shifted the way that we had to think about workforce development and reentry and equipping individuals with the tools they needed to be successful. What Wellness West has done is probably one of the most fundamental shifts in workforce development once again, because there is a high unemployment rate in our community, and like many communities in Chicago, we're at least 3 times higher than the city of Chicago. And there are a lot of people who are just categorized as unemployed. But what we're finding through the job seekers that come through our doors is that many of them have undiagnosed health-related mental health issues that have kept them from being able to connect with jobs today. And so when you don't feel well, you will call off. And eventually, if you don't get whatever is ailing you, you will lose your job. We also know that folks don't have necessarily access to the health care that they need, and they're afraid of going to the doctor. They're afraid of what the costs might be, but second, they're afraid of what the diagnosis might be. And so I'll just say that we love having a community health worker on site at our organization that can connect people who may have, I keep getting headaches or I don't feel well, and connecting them to resources that they can support. Louise is here. Where are you, Louise? I know you're in the building. She is a community healthcare worker over there for the North Lawndale Employment Network. She's the one that will establish that trusting relationship which is so important, and then be able to help them address those health issues and mental health as well, so they can be successful employees.
Dr. Latif, before you begin in this discussion of safety net ecosystem, I want to tell you about a story that I told about a woman who was from about an hour and a half south of here. She needed a kidney transplant. Her doctor wouldn't put her on the list because he said, "You're not being compliant. You're not going to dialysis." Well, why? Because she couldn't get to dialysis. And when we told that story, a doctor at Rush reached out and treated that patient and got that patient on the transplant list. So that is the safety net ecosystem here, but I'll let you answer how you do it in a bigger picture.
We don't do it. We don't do it well enough in a bigger picture. And I struggled because when we were preparing for this, I asked if it was going to be recorded, and I found out it was. And that changes the tenor of how I would answer this question. But I'll try to do it honestly. Like, we studied years ago how long people live. And it turns out, if any of you shopped on Michigan Avenue recently, like bougie areas where all the stores are, turns out if you're born there, you live to around 87. And it turns out that if you're born around here, you live till you're 67. And the single biggest predictor of how long you live right now in this ecosystem that we're talking about right now is your zip code.
That's right.
That's the single biggest predictor. And then when that came out, and when a book was published called The Death Gap by David Ansel, you know what the feedback was? Oh, it's gun violence. It's murder. It's crime. Well, it turns out, factually, it's not. Right. It's diabetes. It's hypertension. It's heart disease. It's cancer.
That's right.
And we hide behind simple excuses because the problems, to fix those problems is too challenging. So if we were honest about it, we recognize that you could fix someone's blood pressure in a hospital, but when they go home, you can't connect the dots to what happens when they get there. And if they don't feel safe or secure, they're not going to go pick up their prescription. If they have to pick someone up and give them a ride to daycare or take care of their grandparents, they're not going to go do the things. They're not going to walk 10,000 steps a day and chart it in a log. Think about what we're saying here. So we cannot connect the dots in healthcare, and our healthcare system is so fragmented, it creates terrible outcomes. We're a hospital, and we're on the west side of Chicago, and we said we're going to try to fix that, and fixing it alone means that we'd have to be in a house. We'd have to understand the challenges of everybody, of what they go through. We'd have to understand that if you don't have a job because you're clinically depressed and you may not know the language, that you'll never take your Lasix for heart failure. And so you'll end up back in a hospital. So what does a collaboration like this do? Why did the word collaboration bring us all together? It's because if we can connect those dots, that's when we start to make an impact. If the people at home, the people in workplaces, and the people in high schools, and the people in colleges all connect dots and understand that your total health is a compilation of all of these pieces, then that death gap will start to go away. It's not going to go away fixing a blood pressure in our emergency room. It only goes away when the community healthcare workers connect the dots around the total healthcare ecosystem.
Heidi?
Why'd you have me go last?
You go first next time, I promise.
Yeah. Not after this guy.
I'm sorry.
No, that was beautiful, and I totally agree with everything that you said. So hi everyone, I'm Heidi Ortola Salvear. I'm really grateful to be here with you today. I'm the CEO of IWS Family Health. Based out of the Logan Square community, we serve the northwest side and the west sides of Chicago. Our mission is to help support families, children and families, grow healthy, strong, and confident by providing trusted, high-quality, coordinated healthcare. So ultimately, we are at this table because it is part and parcel with the work that we do, the way we see the world. And I think that the coordination model, what this does, what the collaborative has enabled for us is an opportunity to go from values alignment, right? Some of the values that you described, to infrastructure, right? And it's infrastructure that is, to your point, lacking, right? And so I'd say IWS Family Health, our role in this system, in this collaborative, is to be a medical home. We pride ourselves in building trust with our patients and being the place that they call when they need care, right? So that we are not confronted, right, or they are not kept from us because of stigma related to healthcare, which is very valid. And I'd say within this collaborative, we're really thinking about how do we create the conditions to help children and families move from a place of survival, which we know a lot about in this moment in time, right, to being in conditions that enable them to really thrive, right? That's what we want to see, and that's why we're here.
So when we talk about this collaboration, this cooperation, this connecting the dots, tell me how Wellness West helps build that bridge in doing that, and I will begin with you, Heidi.
Thank you. I would say, so for us, and I'll give an example. So our community health worker, Maria Candelaria, is right here in my line of sight. So thank you so much for your hard work. But she, in her time working with families, carries a caseload of about 80 families right now, and recently helped a family secure just over $5,000 in rent assistance arrears, right? That would have kept, that had she not received that family would have been evicted, right? And we know the downward spiral that housing insecurity creates. And so that's an example, right? The coordination is Maria Candelaria being able to go use the resources that are available to us because of this collaborative that otherwise wouldn't. And I will also say that for small organizations like IWS Family Health, the fact that we have a Maria Candelaria is because of this collaborative. And so for us, again, it's about that shift from values alignment to infrastructure, and what this collaborative has done is built infrastructure to enable us to respond to the issues we're hearing, right? But not having to own every single part of that response, because we cannot possibly.
Doctor?
I would just build off of that exact example. I mean, we could give examples where our community health workers help find rent support, and that would be great, but, and that happens all the time. But it also was something that never happened before we established a partnership. And one of the examples we have was financial. Another example that we don't spend enough time with is the current epidemic of mental health in this country. And we treat patients as fast and rapidly as we can in a constricted environment, and then they're discharged from the hospital. But a driver of why, for example, their glucose might have been 700 when they came in, or why they missed their dialysis, may be more related to depression, maybe more related to unserved behavioral health needs. Our community health care workers connect them to the resources they need in this blueprint that would otherwise not be connected to them to help them solve the underlying problem. If the underlying problem is I'm scared to take my medicine because I think it'll make my hair fall out, and it doesn't, that gets missed when you're in the emergency room. And there's simple problems that can be solved, and there's hard problems that have to be discussed. And the work that the collaborative does by linking them to mental health services, not just physical health services, but the mental health services is woefully unserved right now across this country. And it's a dam that's leaking that this organization is trying to plug.
Brenda, is there anything you want to add to that?
Well, just to add on, really, that one of the things that Louise has shared with us is so many of our people, like you said, the emergency room isn't the place where you can get
That's right.
those kinds of services, but you need someone who will listen. And so these community health workers, the role that they play is that if you are depressed, and it makes sense to be depressed, you don't have a job, you don't feel well, you're worried about your rent, all those social determinants, right, affect how you show up. And so if there's someone that is willing to listen, and not only listen, but then connect you to this broader coordinated set of services, then that's transformative. That is transformative. You know, Louise was sharing with me that there was a young woman who always went everywhere with her two brothers. There was a traumatic incident that happened early in her life. And as a result, her brothers were very protective. They took care of her, but she was afraid to show up without them. When she met with Louise and learned that there were mental health services and counseling available, Louise tells the story far better than I do. But at the end of the day, she was able to deal with the trauma of her youth. She doesn't need her brothers to walk her around anymore. She's actually working today. And so she has had a transformative experience that I can tell you 4 years ago, before we were part of Wellness West, that wouldn't have happened. That would not have happened at a workforce development organization. But now we have this incredible outreach and resources to help address those unspoken challenges that are barriers to people working.
It's beautiful that we can celebrate some of those successes, even with so many challenges. If you could identify perhaps the biggest challenge right now that you think about this Healthcare Transformation Collaborative needs to address as we move forward.
Well, I'll just say that one of the things that it just needs to continue. I cannot imagine doing this work without this collaboration. We are a safety net, and I agree, it can be better, but oh my gosh, it is so much better than it was. And when we talk about all these wraparound support services, coupled with the need for mental health and medical care, these are examples of how expensive it is to be poor.
Profound statement.
It is expensive to be poor. So when you are stressed and you're depressed, you have high blood. And what was interesting is that depression is actually one of the highest issues, right, Louise, that we face in men. That sort of surprised me as well. But if you're the head of the household, if people are expecting you to generate revenue, take care of themselves, then I can see that. But we don't talk often about men in particular that are struggling with depression. So I just think it's the weight of poverty that we are actually addressing through this collaborative by providing incredible health care.
Yeah. Would either of you like to add to that?
I would echo that the biggest problem is sustainability, right? This work can't be sustained with pilots, right? Like, we need a long-term investment and commitment in this kind of approach because it's fragile. And so while we get to celebrate tonight, and it's exciting and I think so necessary, to your point, to have a moment to stop and say, this is something good that is happening right now, it feels fragile.
Mm-hmm.
Yeah, I mean, I could talk for about an hour I could talk for hours on what are the challenges around healthcare right now and what are the biggest challenges we face. The reality is we spend more than any other country in the world by far, more than double the next country, and we have the 19th best outcomes. Mm-hmm. The 19th best outcomes. I don't think that's something we should be proud of. We have phenomenal care for people that can access it. If you have a lot of resources, you can go get incredible care. If you don't have those resources, you can't get incredible care.
That's right.
The fragmentation that exists today in America in healthcare is our biggest challenge. If you have strep throat, you need an antibiotic, you should get an antibiotic. Wherever you are, whatever you look like, whatever address you live in, hard stop. The fact that that's somehow now controversial has to be one of the biggest problems we have. The fact that healthcare around the subject matter in the world to tell this story.
All the people here have the same goal. How
Talking about it as if it's somehow controversial, nervous around the subject matter. So what are the biggest problems that we have right now in healthcare? We have a lot of people trying to solve things in their world, and we have to use organizations like this to connect the dots. And we almost need the best PR firms in the world to tell this story so that we start solving the problem.
We have about 2 minutes left. I would like each of you to address the crowd here and give some marching orders to people. Let's look ahead. All the people here have the same goal. How do we build on the success between healthcare and social services while addressing the challenges? Brenda, you want to start?
Sure. So I'd say keeping in mind that this is not a sprint, it is a marathon. So staying centered in that and telling our stories, right? It all goes back to the human impact of the work that we do and the lives that are better for it. And that's both the stories we need to tell because that's our moral compass, and then the stories we need to tell because that's how we know what works, right? And so that's what I would say. Keep your eye on the long game and go back to the impact and the stories, and let's be loud about that.
Doctor?
I feel like I talk too much.
Oh, so good.
So here's it. We have a story to tell. We have a story to tell in this room. I walk in the room and I'm like almost ashamed to come to this stage because I'm walking to people I know and I know the work that they've done. I've heard about it, I've read about it. And at each table, there's heroes, and those heroes have saved lives. And you save one life, it's equivalent of saving all of humanity. And to me, it gives me goosebumps and I'm excited. That's optimism. There's people in this room that are trying to solve the problem. We have to tell our story. We have to tell the story about what it takes to improve the health of our community. And we have to mandate that healthcare is a natural right.
Brenda?
Just quickly, I have to echo the same. Healthcare is not a privilege. It shouldn't be. It's a right. And so we have to make sure that, and I think that we can't let class determine the quality of your health care. It makes no sense to be in this country and to hear that stat and know that there are people going without. So we just have to, again, keep telling our story, but also let's change the narrative and really stand on the fact that it is a right to have quality health care.
Amen. Well, I thank you for answering my questions. I don't know if all of you downloaded or scanned the QR code if you had any questions, because we'd like to do a Q&A with folks in this room. They come on my phone. So,
And then you're
did any of you download the QR code or scan the QR code so that you could ask questions? Okay, do we have some questions? Great. How can healthcare and social agencies work together to create a pipeline of future public health professionals?
It's a great question. I'll just say that's beginning to happen, where there are partnerships with workforce development organizations and hospitals and other medical facilities to help build a pipeline. We welcome bringing healthcare professionals to our agency and making sure that healthcare is seen as a viable and exciting and really almost recession-proof, career to go into. So I believe that that's happening through several partnerships that are in place already.
So the next question, unless you all have something different to say, what are the most effective strategies you've implemented to improve communication and data sharing between primary care providers and specialists, and how can we expand communication with community organizations?
I think there has to be a push in this country to democratize data. Your healthcare data has to be your healthcare data, and it has to be easy for you to access. If you're in Virginia driving and you pull over because your leg is swollen and someone does an ultrasound and then you get back and it's negative and you get back in your car and you drive to Chicago and now you're short of breath and you were driving through Virginia on a Saturday, by the time you got to Chicago it's a Sunday, it's closed, you can't get your medical records. Right. We're talking about how do you get the primary care doctor to share with the specialist. You can't get one ER to share with another ER if it's in off hours and you're getting a repeat CT scan. We're driving up the cost of care. How easy would it be if you had your information on your phone? How easy would it be is if you owned and accessed that information. Now there are people that can figure out little pockets of this, but it shouldn't be that complicated. My mother, in her 80s, should be able to figure this out on her phone. She could download just about every app. She can complain just about everything that I've done, right? So she should be able to download that app and understand her data and share that. And if you can do that when you see a specialist, you can connect the dots on your own. Individuals have to advocate for their own health when they can. We have to make it easier by opening that threshold so they can access their data.
Do you have a thought on that one?
I don't know that I have a specific example of where I see it working especially well. I think that we are trying, and it's a patchwork, right, of efforts, different efforts. Yeah, I don't know that I have much more to add to that one.
So the next question, this forum is all about dismantling silos. How is your organization participating in dismantling
On our own, affecting that.
It's from each
People who, that is
That's what healthcare is.
So we think about our care model really comprehensively.
and we think about how we cannot do all the different components on our own, right? And so one example is we're in a planning phase for a project where we're going to be co-located with other community-based organizations, right, in the Belmont Craven community, and some of those folks are in this room tonight. So thinking creatively about, does it mean physically sharing space, right? Does it mean showing up, not just at like when we need something, right, but are we there for each other to learn about the experiences that we're each having in our respective sides of the equation, to then understand where the opportunities lie, right? So really cultivating those relationships, taking the time, prioritizing that, because in the absence of doing that work, again, it becomes band-aids, right? And so we're not creating the space and the opportunity for that kind of creative idea generation.
Final thoughts from each of you on our last question. How do you plan to continue the good work? Brenda?
Well, we will continue the good work. As long as you have people walking through our doors that clearly need assistance, clearly need more than a job, because everyone thinks that the job is the answer. It's not if you're not well. You can't stand, you can't walk, you can't see, if those issues, haven't been addressed. And so therefore people will lose their jobs. And so, as I said earlier, just as we learn the importance of changing the way that we integrate people who have served time, who come with a whole host of health issues, we will be firmly rooted in understanding that healthcare and mental health are fundamentally a part of workforce development. That is part of being job ready. That's not a narrative that you hear often. That is not what we talk about. But we are standing firm in that, and glad that we have the kind of partnership that we have, and working with this industry.
I think taking care of people is the greatest gift you can have. I mean, if you could lift someone else up, if you can make an impact, it's self-fulfilling, and the most selfish thing you can do is help other people. And I think that's what healthcare is. And so your question is, how do you keep going? I think it's not a struggle to keep going. And at times like this, it's a necessity to keep going. And at times like this, it's a necessity to speak louder.
I would add though too, especially for many of the folks who are here doing this work, right? A lot of times there's vicarious trauma or like direct impact, right? Because we are in many ways reflective of the communities we serve. And so recognizing that and telling each other, like, we are here, like, Maria Candelaria, I'm right here, you want to come talk to me? Walk into my office, right? And like holding space for each other, recognizing that this work is hard. There are times where we need to pause, celebrate, right? And hold each other up, right? Because it's a marathon, it's not a sprint.
And that's why we are here tonight, together, trying to inspire one another. Thank you so much for your insights, and really thank you for what you do. Now we're talking about reimagining care when it comes to sustainability. I'd like to introduce our panelists here. Nancy Zhao, who is the Healthcare Collaborative Director, Illinois Department of Healthcare and Family Services, and Crystal Gary, Meridian Health Plan of Illinois. Thank you, ladies. She taught me how to say her last name correctly, so I'm just giving you a credit for that, right? So Illinois Healthcare Transformation Collaboratives were launched to try to close these gaps, right? Build more equitable, community-based systems of care. From your perspective, why are the collaboratives like Wellness West so important in this moment right now?
Well, thank you. I want to thank, again, the Wellness West team for hosting this event tonight and for inviting me here. I'm excited to be in the room with all of you all, and also to see some of our other healthcare transformation collaboratives here as well. So for me, we just heard a lot about the value of this collaboration, and I really liked what Heidi noted about setting up the infrastructure to do so, because we know it's hard, right, to really break out of the day-to-day of, doing your own job or looking out for the interests of your own organization. And with the agency, we really wanted to be able to facilitate and enable organizations to come together and build that durable infrastructure, that extra capacity to be able to come together and serve our Medicaid customers in a more holistic way. So it's really important for us to continue because, all these changes take time and, in the 3 or 4 years since this program has come live, I don't think we've fixed all the social challenges that are out there that are, making it hard for people to access their health care or to be able to address all of their health needs. So to us, I think this work is really important, and especially in the face of even more kind of budget constraints and funding constraints that I know we're all experiencing at different levels, it feels even more critical to build on this model of coming together and saying, okay, what is my unique organization positioned to do? What is yours able to do? And how can we kind of maximize our resources together?
Crystal, how would you answer that same question, Wellness West, and why it's so important for collectives like that right now?
Yeah, so I would build on what Nancy said about the holistic approach. So, let's be clear, collaboratives, the health transformation collaboratives like Wellness West are critical because health disparities exist. That's why they were created, because there are persistent health disparities that we experience in our communities, and there needs to be a holistic approach to address the needs of people who are in under-resourced and disadvantaged communities. And the reason why these collaboratives are so important right now today is because on top of all of that historic experience, right now we're seeing just an eroding of the trust in our institutions, an eroding in access to services, and you really need to have these deeply rooted, trusted partners, people, trusted organizations that people can go to for information, that people can go to for their needs, and when they're scared, that doesn't end up being a barrier that they can't overcome to make sure that they are getting what they need to stay healthy and to get what they need.
And just a story yesterday on breast cancer, the number of deaths are going down, except in the Black and Asian community. And it doesn't make sense, but in speaking about the challenges here, we understand some of the barriers. We've talked so much about the challenges. I'd like to give a little bit of hope in the room. We can talk about what excites you most about the progress so far. And I think that's important because when we talk about sustaining this, we need to build on those successes.
Yeah. Well, what excites me is the successes that we've seen in actually getting our members, and I should have said at the beginning, for those of you who don't know, Cedar Meridian Health Plan, we are one of the Medicaid managed care plans. And so when I talk about our members, I'm talking about the Medicaid enrollees that we have, that we are responsible for. And we've really seen success in getting many of our members access to services that help address their health-related social needs. And in particular with Wellness West, they help us to know when one of our members is in one of the partner facilities. And they've really helped us to engage with those individuals and to help get them into programs and resources so that they can manage their depression, manage their diabetes, manage hypertension. And it's that kind of individual, approach that can really make a difference in people's lives.
Just building on that, I think for me, I've been really excited, and I know many of our meetings with the collaboratives these days, as well as with our managed care plans, are really starting to look at the data. And we are seeing some of that early evidence about impact both on the quality of care, the type of care encounters people are utilizing, and then also early signs of impact on costs. And so, you know, I'm sure Wellness Plus has called out some of their results in their report as well. But, you know, I'll just give an example. We were starting to see as our managed care partners are looking at those measures across collaboratives, things like reductions in emergency department utilization. That's a great outcome, right? It is showing that people are understanding where to go for care first, that maybe they are adhering better to their treatment plans, they're able to address their broader needs and are not escalating to need to visit the emergency room. And so those kinds of measures I think are really exciting to see. And then, you know, just more broadly, you know, speaking to Wellness West too, I just find it so incredible to hear and see so many organizations coming together, right? When the agency laid out the vision for this program, and I was not here for that, so, you know, kudos to our elected officials who displayed their leadership in calling for that, and to my colleagues, you know, who really helped us set up this program. We were looking at communities, right, where disparities exist and looking at what are those disparities. And I think it's really powerful to come here and see the community really coming together and really so many organizations participating, being able to reach so many people. I find that very exciting.
I want to get in the weeds a little bit about why it's more important than ever really to establish this path forward. And some of the biggest hurdles are financial. We've got the government shutdown. We've got rising insurance costs. HR 1, the so-called big beautiful bill. Medicaid set to be cut by $1 trillion over the next 10 years. That's the largest reduction in the program's history. I imagine it has to feel for you and those of you here like you are drowning in these deep cuts and the uncertainty of the future. So what are health and social service institutions doing to try to get out ahead, to be proactive? That's a big question.
So I mean, I'm happy to start. I know that, you know, that was a big question. So I guess I'll start with the bill. You mentioned several things, but I'll start with the bill. So in my mind, I think it's really important to understand what that bill does and what it doesn't do. So yes, that bill does contemplate a huge reduction in Medicaid, and some of that reduction in funding is going to hit state budgets and going to hit providers very hard, you know, in the not too distant future. There are other things that that bill does that aren't actually, the one thing that bill doesn't do is it doesn't act, for the most part, it doesn't actually cut eligibility and it doesn't actually change services, right? What it does is it creates barriers for people and it assumes that those barriers are going to be so great that people are just going to give up and drop off of the program. So that is not destiny, right? That we don't have to just accept that. Over the coming years, as those things start to be put into place, it is our job to make sure that that doesn't happen. And the state, there are things that the state will be able to do once, you know, more details come out, and figuring out how to implement that and hopefully streamline it in a way that makes it as easy as possible for people to comply with those requirements. There are things that we as an MCO will need to do to connect with our members and help them through the process to make sure that they stay on, you know, whether it's submitting whatever documentation they need to submit for the work requirements, because we know most people on Medicaid work, right? It's not that they're not working, it's that they are going to have to prove it in different ways. You know, the more frequent eligibility redetermination, helping make sure that they're navigating that process. And there are people, everyone in this room, the community-based organizations and providers and collaboratives will also need to be connecting with people and helping them navigate through this and helping make sure that they don't just give up and don't just disengage from the process, but that they are empowered and able to do what they need to do to make sure that they are getting the benefits that they are entitled to in the care that they need.
I can try and speak a little bit to how HFS is approaching this and to Crystal's point, a lot of that loss is really due to the work requirements, which will go into effect January 2027, and it's anticipation, not that folks aren't actually eligible and wouldn't meet them, but just the administrative burden of proving that you're working at least, I think it's 80 hours a month, and having to do that every 6 months. So the agency, you know, our goal is to really, we are working very urgently as part of a, first of all, interagency effort together with DHS, because we do have an integrated eligibility system. We're working with them and with the governor's office to start to prepare for implementing those requirements. And unfortunately, as many folks in this room probably already know, SNAP work requirements are already in effect. And so in that way, DHS is already ahead of us in some ways in terms of having to figure out how to get it done. And we're going to be building on that. You know, our goal is to really try to implement these administrative hurdles with kind of the least harm that we can manage to our customers. And our goal is also to maintain as much coverage as we can. And I think, you know, we are looking to groups like Wellness West and our healthcare transformation collaboratives to inform that effort, right? The same way when, you know, the COVID emergency unwinding, there were some administrative changes that would make it, again, difficult for people to prove again, hey, I'm still here, I still want to be on Medicaid. We have to work with our community partners to spread the word and help them understand what they needed to do to stay enrolled. And so we're really going to be looking to partner in that way to try and counter those impacts.
How does specifically Wellness West help you to kind of move some of those roadblocks?
Well, you know, the organizations here, our community health workers, our frontline workers, you all are the ones who interact with the public, right? And so, you know, being able to spread the word, the most effective way to do that community outreach, that's one really important role that we look to our CBO partners to advise us on. It's interesting, you know, just I think some thought I didn't connect until just now too, like part of the beauty of having partnerships like this where we have, for example, workforce development agencies connected is that also raises possibilities about how do we handle that proof, right? And it kind of, you have an existing partnership to build on. You know, many of our collaboratives have been working too on figuring out how to exchange some basic data with each other. And so I think that just kind of opens up a lot of room in terms of helping make sure that people can meet those paperwork requirements.
So Einstein said, in the midst of difficulty is opportunity. It's a pretty difficult time. Talk about what the opportunities are. What do you see as the greatest possibility right now in the road ahead?
Wow. So, yeah, never let a good crisis go to waste, right? I see a lot of, you know, opportunities, and, you know, my mother always told me that, what is it, need is the mother of invention, or something along those lines. So, one thing that I think is important is that as some of these things are going into effect, whether it's the, you know, kind of ongoing, you know, impact of the shutdown, which hopefully won't last too long, or as we're looking at the bill starting to get implemented, you know, we have a healthcare ecosystem that is already under some strain. You know, Dr. Lateef talked about that a little bit in the previous panel, and we think that there's going to be additional strain. So trust me, I'm getting to the opportunity in a second. So, you know, when we look at that, it's really important to have collaboratives like this where you have all of those individuals, all those individual organizations in partnership and collaboration, because you can make that collaborative, you know, the whole stronger than the sum of its parts. We're going to have to come together and do that because we may start seeing situations where, care is harder to access, where there might be longer wait times for certain kinds of appointments. You might see, more hospitals closing OB units or things like that. And I've seen in areas where we've actually been successful in being able to address some of that and take some of that burden off of the healthcare system through more innovative types of partnerships, like mobile maternal health units, to take care to where people are, those people who are living in maternal health deserts after an OB unit closes. Have an innovative approach to that, to be able to bring different types of telehealth programming to people so that you're getting them access to trusted information, maybe reduce the amount of times that they might go to an emergency department unnecessarily, and then being able to address some of their health-related social needs in a way that keeps them healthy, so that they're able to better manage whatever their conditions or healthcare needs are, and they're not going to the hospital or to the healthcare system as often, and that increases the capacity and increases the resilience of the community overall.
All right, I have about 3 or 4 more questions, but in the interest of time, I know you folks are more important than I am, so I'm going to ask the questions from the audience. How does CHW work help impact reducing total cost of care?
So community health workers, community health workers are an important, just a critical part of this. We're really excited about the, the movement toward reimbursing community health workers, in the future, near future, I think. I don't remember when that goes into effect. So one of the things that we've learned as a Medicaid managed care plan is the importance of having what we call boots on the ground. So you really have to be able to connect with people. The Medicaid population in particular tends to be transient. It tends to, individuals tend to have more acute needs. So having people who are, in the community who have similar lived experience and are really able to engage with people in a culturally competent way, build that trust, and help to connect them to, to the resources that they need that is the way that you get people, that you get people engaged. It can be very difficult to get individuals engaged and empowered in their care. So the community health workers help to connect those dots, and then once you get people in, they start, they start engaging with their primary care provider. They start engaging with their care plan. That's where the total cost of care starts to go down.
Do you have anything to say to that question?
No, just, it's really all about that preventative care and...
Okay,
So, from this big, beautiful... In front of any health challenges or needs a person may have before it leads to a worse outcome or, frankly, very expensive care.
Okay, what can we do collectively or individually to advocate and let our voice be heard on this important issue? When we walk out of these doors, what is our collective call to action?
So, I think the agency's approach is certainly, planning for the worst, but that doesn't mean we don't continue to hope for the best in terms of there's still time before a lot of requirements from this big, beautiful bill come through, and, we certainly see part of our role as continuing to advocate with our elected officials, in partnership with our elected officials. But that being said, we are kind of moving forward with implementing all the anticipated changes. Similarly, I hope that all the organizations here feel empowered to lift up your voices to us, right, about what is and is not working about the system and the incentives that we have at play. There's so much to even try and unpack with sustainability, but when it comes to paying for outcomes, I think we're all still learning about how to do that, and we are struggling through reimagining a different way to pay for those health outcomes and rolling back kind of the old. And so we need to hear from all of you who are delivering that care in terms of what's working. I think earlier, Crystal, you said something about, in times of difficulty, kind of letting that breed creativity, and I really agree. I hope that these kind of constraints and threats that we're all feeling can kind of open up and create some real focus, some real creativity to kind of think beyond our typical way of doing things and imagine kind of a better way. So, that's what I hope that everybody in this room will continue to do.
Crystal, do you have any thoughts about that, or a collective call to action?
Yeah, so I would say everyone in this room is as a healthcare leader or a community leader, so stay engaged, be that trusted voice in your community, with your neighbors. That's really needed, and it's going to be needed anymore. There's so much misinformation out there, or there's even going to be some true information out there as people learn more about this bill and what it does, and people are going to be confused and scared, and really, you can be important advocates and important voices in that education. And then also stay engaged in the process. This bill is going to be, it has a 10-year time frame, and a lot can happen in 10 years. So, I think we also need to remember that this isn't destiny, and so stay connected with your local elected officials, stay connected with your Congress, members of Congress, and continue to share the stories share this story about what's happening, what works, and share the stories of what's not working and what the impact really is, because there could be opportunities to change and to modify things and, maybe mitigate the impact of some of these more draconian, policies in the future.
Well, thank you so much for your insights, and you are right. Let this not be the end of our evening, but let it be the beginning of continuing amazing work. Thank you all for coming. I'd like to bring Misty up for one more moment to make some final remarks.
I hope that you guys can hear the passion and the commitment to a care model that works. I want to have a big thank you to our moderator, Dina, as well as our panelists, Nancy, Crystal, Brenda, Heidi, and Omar. I want to just acknowledge actually Heidi. I think Heidi had to leave. But she's here today, even as her staff and patients are encountering federal agents right now in front of her clinic. And so I just want to thank her for being here and for really standing, and we stand in support with you and your staff to ensure that your patients have the ability to access healthcare without fear. What I also want to say is that I think Omar was in my head over the weekend as I was on the beach with some friends. Because from time to time, I pick up this book that I was given when I was in college, and it's a book that contains Martin Luther King's speeches, a few of his speeches. And the one that's my favorite that I read every year, and typically it's around MLK Day, right before I start yelling at my kids to get up. This is not a day of rest, we gotta go work. But my favorite one is the one that's entitled Remaining Awake Through a Great Revolution. And this was a speech that he gave. It was an address at Morehouse College commencement. And so I read it from time to time, but I sped up that timeline a little bit because I just felt like it was really important for me to read that particular weekend and to get centered. But the one thing that really stand out to me in that speech is this particular phrase from his speech. And what he said was that now the greatest question facing us today is whether we will remain awake through this world-shaking revolution and achieve the new mental attitude which the situation and condition demands. And our conditions today demands our attention. And so I want to thank you and everybody for joining us today. I want us to also not only acknowledge kind of all the hard work that we've been doing today, but I also want to just acknowledge the hope that we have in the future, particularly around creative ways in which the state is thinking about financing for health-related social needs, as well as supporting our community health workers that are on the field every day. And so I want to acknowledge them today. So if you can just raise your hand, because it's just so important for the work that you guys do. So thank you. Thank you all for coming this evening. Feel free to leave your name tags on the table. You will get an event survey. Please fill it out. We would love to hear your feedback. Drive home safely. Thank you, guys.